Good morning, everybody, and happy Monday. Welcome back to your lunch break with me. My name is Ivana. If you are new here, I hope everybody had a wonderful weekend. I know I did. I spent probably too much time in the sun. You can't tell to wear that high SPF, but I hope all of you had a great weekend. And today I am going to just give y'all, it's Monday. I figure that everybody could use a recap and a little bit of an update on where we stand in Alabama in our coronavirus case numbers. So I have brought back on our own AL.com reporter, Leada Gore. She has been keeping up with all of these every day and bringing you the latest COVID numbers and cases by county every day. So if you have questions about specific place and area, please let Leada and I know. I will be watching on the comments. And otherwise, Leada, let's just get started. I know that today you said our total case numbers are at 99,390. Yep. That is getting scary close to 100,000.
Yeah, and I was thinking about that this weekend. Let me put on my glasses so I can actually discuss things and see them. I was thinking about it this weekend when we first started this in March. Our original goal as reporters was to report, we were reporting by case, each person, anything we knew by case. And we got up to about 30 and we're like, okay, this is going to be hard to keep up with. We had no idea at the time we'd be staring down 100,000 cases. So yeah, we'll roll over unless a miracle occurs between tonight and tomorrow. We'll roll over 100,000 cases tomorrow.
And do you know, Leada, what you're talking about the beginning in March when, like you said, we talked about, and I remember this discussions in our newsroom. It was like, we have to find these people and we have to do everything we can about them. And it got out of control so much faster than anybody imagined. Do you know what the state originally maybe projected the case number to be?
No. And I think that was part of their issue is that nobody knew. If you remember the original, New York Times maybe prediction that had Alabama as the worst case in the nation had us at 7 million cases. It was crazy number. But we've seen it all over the map. Now, if you had asked me in, let's say April, May, I remember the first time we added more than 100 cases a day, it was concerning. When we added 600 cases a day back in, I would say May, the health department sent out a note explaining why there were so many cases on one day. Well, we're regularly, it's news now when we're below 1,000 cases a day. So it's really grown so much more. But I don't think that's just something that the Alabama Health Department didn't know. I don't think anybody in the whole country knew, the type of numbers and the doubling rate that we are seeing. And it was hard to predict. Yeah, it was just hard to predict.
And I like what you said about, we're at the point where it is news when we're under 1,000 cases, because there were several days when we were almost at 2,000 cases added overnight. So today you said that overnight there have been 1,655 new cases added. What is that? Are we supposed to celebrate that? Is that good news? Is that bad news? Put that in perspective.
It's not the worst. It's not the best. I would love to see us where we were a couple days last week where we were 800 and 900. But there's a couple of caveats there. And one is comparing day to day is not a perfect science. Our rolling 7-day average is going down. That is very good news. Because as I explained to somebody last week on our Facebook page, data is entered by humans and humans are going to make error. And so I always say they added that total number of cases overnight to the data. That doesn't mean we added 655 people yesterday that tested positive. There is a delay in getting the data and that type of thing. But it is still a good number to monitor because I like it more on a granular level for the counties. For example, yesterday, Mobile added, I jotted note, 570 cases. That's extremely high. That may be the highest we've had from one single county at any time. But Mobile's had some data reporting issues in the past, and they've had some doubling up of days, and we always see a little bit of a tick up on Monday because some of the labs aren't reporting on Saturday and Sunday. So, and so that 570 from Mobile, if we saw 500 every day for a week, I'd be more concerned. We'll keep an eye on it and see what happens tomorrow. But 570 in a day is outrageously high.
I want to get back to something you said a minute ago, but quick question from Steve. Steve says, are these new cases or a total of new cases? So Steve, that 99,390, that is our case. That's our cumulative case number. So that means since we started doing this reporting in Alabama, there have been over 99,000 coronavirus cases reported. So that's not a new number. That's just what we're adding to as these numbers come in. That 1655 number that was new cases overnight, that is what Leada was talking about with the new case numbers that are being added in. Again, keep in mind, this is Monday. As Leada said, some labs are not reporting Saturday and Sunday. So we have that bulk number from the last numbers that we got over the weekend, if that makes sense.
Yeah.
So Leada, let me ask you, you mentioned something about a rolling 7-day average, and that rolling 7-day average of coronavirus cases in Alabama has gone down. What exactly does that mean?
Well, what that means is if you take it that 7-day period, our average increase has slowly declined, and our 14 is slowly declined. And what's interesting about that is, of course, you go back to the mask ordinance that Governor Ivey announced, that we're starting to see, and it's not just me starting to see it, health officials are saying that we are seeing a little bit of a decline. That maybe the mask ordinance is working. And I can point to my home county. I live in Madison County, which is Huntsville. And Madison County was super low. When Birmingham was 300 cases, Madison County was 4. We were super low for a long time. We opened back up and we went straight up. We were within the 200 case a day, 185 case a day. Madison went to a mask ordinance earlier than the state, and we have gone down. We have seen our case increase today has been in the 60s, which, for a county of, 350,000, that's great. That's good news. Same thing we've seen with Montgomery. Montgomery had a huge problem, and not just a problem in numbers, but a problem in healthcare access. And they instituted that mask ordinance early, and it started to creep down. So I know masks are controversial. I don't like them any more than anybody else. I was dying this weekend wearing a mask outside. But as I said on Twitter earlier this week, if it means I do not have to homeschool my child, I will wear a mask till 2029. I'm fine with that. That's fine with me.
I'm sure so many people agree with you on that. I do not have children, but my heart goes out to all of you, honestly. A question here from, let's see. So I can't find it now on here, but there was a question about hospitalization. Do you know what our hospitalization rate right now is?
Actually, I just looked at the latest number, and the latest number is a little under 1,600. And that's statewide. What's interesting about that number is a couple things. One is it has stayed very consistent. Once it skyrocketed up, which we saw when everything opened back up, we've been in that zone for quite a while. Now, the thing you have to remember about hospitalizations is that is a very best guess sort of thing, because you don't have the same number of hospitals reporting every day. And there's kind of this weird, are you hospitalized because of COVID? Are you hospitalized with COVID? If I go in to have my tonsils out and I test positive for COVID, I'm probably not going to stay for my tonsils being out, but my appendix out, whatever, I get taken out. You run into that. So what, you look at ICU numbers, our ICU numbers have dropped. Our number of ventilators have dropped, not huge drops, but we are starting to see that sort of progress in the way things are going. The other number that I think is, I get asked all the time, why don't you report recoveries every day? How many people have recovered? And as of today, it was 38,000. And the reason we don't always include recoveries every day is that number's only updated once a week. So it doesn't change like your case numbers. Now with recoveries, you're running into the exact same thing you are with hospitalizations, which is it's a very loose thing to say, are you recovered? Basically, that means you've served out your quarantine, which is now 10 days instead of 14 for most people. You're not actively showing symptoms. You're not hospitalized. But they don't come to your house and take your temperature and say, are you recovered? For the most part, I guess they could, but they don't. So, that's one of those figures like hospitalizations that you get close, but you're not going to be 100% on the number.
I think that I'm glad you said that because we have a question from Aaron, and Aaron says, is there any way that we are tracking currently infectious cases? In other words, while 99,390 cases since we started tracking is bad, how many people are currently infected?
Yeah.
Can you answer that? I know that there might be a little math involved. I actually got out my
just did it.
calculator.
I was a history major, so y'all get on me now. But my math skills have improved during this pandemic. It's one of the few things that's gotten better. I would say, you're looking at 60,000 active cases. Again, the health department, this is another one of those questions that I get asked a lot. They don't break out who has symptoms and who doesn't have symptoms. We don't get a number that says X number are asymptomatic, the following numbers have symptoms. So all we can do is guess. So if you're saying 60,000 active cases, let's say a third don't show symptoms. That's a total numbers guess. Mm-hmm. But that's where it's never going to be exact. And frankly, I get a lot of comments wanting to know why we don't report more of that really detailed data. And the bottom line is they're not tracking it. It's not being tracked by the health department. Don't yell at them. This is new, and they don't have thousands of staff to go out there and do this sort of tracking.
Right.
So it's, I do wish we got a little bit more breakdown in ages, because we get like 24 and under. Mm-hmm. And as school starts back, it would be very helpful to have maybe 7 to 18, or that 5 to 18 school age range. I think we might see some more data coming out in Alabama about that particular age range as school starts back.
So now we're under that 2,000 or nearing 2,000 daily case adding number.
Yeah.
Is that something that has been, as you said, going down for the last week? Do we know, if we say we added 1,655 last night?
Yeah.
Are we kind of staying below and around that 1,500 number?
Yeah. That 1,500, I would say, would be 1,400, somewhere around that. Like I said, last week we dipped as low as 888, I believe it was. And one day we were 900. And then the next day we shot back up to I think it may have been over 2,000 or close, 1999, something like that. And so that's where you start questioning the data on the low day and the data on the high day. Mm-hmm. You have to kind of look at that average and say, okay, overall, are we trending downward? And the health officials say yes. But at the same time, we're starting back school. And it's not a matter of if, it's when. And, don't panic. It's all going to happen in everybody's school. And so we expect to see, as people, just like we saw when people got out and went to restaurants and churches and wherever they went, it started to go up. And, mm-hmm. It's just that comfort level of what are we comfortable living with.
Right. Quick comment here from Ellen says that her cousin Mark was just diagnosed this past week. We're thinking about him, Ellen. Best of luck to your cousin and to your family. I want to get a little bit more specific in some of these areas. We've got a lot of people wanting to know about their county. Sure. So question from Amanda about Chambers in Lee County. Now, I know in the early days, we talked a lot about Chambers in Lee County. There was a very early outbreak in that area. How is that area looking now?
Lee, I would put in the mid to better zone, and Chambers, I would put in the better zone. Some of those early hotspots, we're seeing some real improvement in. Lee, obviously, you're going to run into some college issues, and we don't really have those numbers yet. Our big gainers right now, other than these really isolated, like if you have a breakout, just like always, if you've got that increase at a nursing home or a healthcare facility, are your major Mobile, Jefferson, and then we'll see like a weird outlier, like a Marshall will perk up. On a really positive note, we had a real issue in DeKalb County that has stabilized and gotten a lot better. And shout out to Dallas County where Selma was, because I was really concerned about Dallas County. It just did not seem to be doing well. And Dallas has really turned it around and brought those numbers. We're down into, sometimes single digit increase a day. So, wow. and what's really important, all the Black Belt is doing somewhat better if you just look at straight case increase. And why that matters so much is you do not have some of the access to healthcare. And so when you don't have access to healthcare, they're going to Montgomery, they're going to Birmingham, they're going to Mobile. That puts strains on areas where there's just a lot more people. So if we can get these rural areas really turned around and focus in on those major cities, it definitely makes things better for the whole state.
That was my next question. That was my next question about the Black Belt from Brittany. She asked about Wilcox, Clark, and Marengo County, all in that area.
Yeah. I use this theory. If I don't remember your numbers directly, then you're probably in pretty good shape. I remember Mobile's 570 case increase. You know, those kinds of numbers. But when I see, or if I see just several days of 50, 60, 70, 50, 60, 70, that's when you get concerned.
Right. Let's talk about the positive testing rate. We've got several people asking in the comments, and we've got a lot of people that just talk about it on a daily basis saying, well, the positive cases are going up because testing is going up. The Department of Health has come out and said, no, that this is the positive testing rate as a percentage.
Right.
And that is not how the data works.
Right.
Tell us a little bit about that, and tell us about that testing rate. I know, believe it was last week, Alabama was at a pretty high number of about 19% positive testing on that testing rate. So what are we at now?
Okay, just to explain it just a little bit. So when you test 100 people, whether you test 100 people or 1,000 people, if 13% are positive with 100, 13% are positive with 1,000, it's just the 1,000 represents a lot more people. We are around, I think the last numbers I looked at were 13 to 14. That sounds horrible because if you look at the national benchmark of 5% and below, it's not good, but it is better. And interestingly enough, I read something last night that New York State is now below 1% positive testing rate. If you compare that to April, when they first started wide scale testing, they were at 45%. Now, when you test, you know, they weren't doing wide scale testing back then, which was 5 months ago. But it's very interesting. So we need that number to keep dropping. And what was concerning me was we were seeing a real shortage on testing supplies, the activator they used to do the test. And the more of that shortage, they really cut down on the number of tests they were doing. Well, let me talk about North Alabama. When North Alabama's numbers were really low, North Alabama was testing. They were like, come one, come all. Everybody come on, let's get you tested. Well, when you start running out of supplies, you can't do that. So some of that higher testing percentage, it makes a difference whether you're testing symptomatic people or everybody come on. Because if I'm testing 100 people who all tell me they have coronavirus symptoms, my percentage will be higher than if I'm just testing 1 million people, whatever. So you do have to kind of keep that with a grain of salt. But again, we're not out of the woods, and I don't want anybody to go run out with their mask and breathe in Walmart today. But I want them to realize that maybe it's a little bit of motivation to do more of the right thing because it does seem to be working.
That's a good Monday news for us there. And I think that, you know, one thing you mentioned was North Alabama. We did have somebody, I believe it was Eunice, who asked about Huntsville. So how is the Madison County area doing?
Madison County is back into the 50 to 60. We've been as low as 36 new cases a day. Madison County and not just Madison County, but it's kind of the whole North Alabama area, other than Marshall and DeKalb, have been low per 100 population the whole time. They've really done better, and who knows why. I think a lot of it is they shut Redstone Arsenal down and sent 40,000 workers to work from home. That helped. When your largest employer is all working from home, or 99.9%, that helps, you know. North Alabama did not suffer the brunt that some places did. We swung up, local leaders proactively got involved, and I think we're seeing some results on that. I know one of our issues here, our leaders update on Monday, Wednesday, and Friday, the local authorities. And I always tune in because you get these little tidbits of fascinating information. And one of them was Huntsville Hospital owns most of the hospitals in North Alabama. They are affiliated with Huntsville Hospital. And it wasn't bed space, it wasn't ventilators, it's personnel. It's, do we have enough nurses? Because our nurses have been at this now, and doctors and nurse practitioners have been at this now since April. You know, are we going to have enough people to keep serving We've got supplies, we've got equipment, but do we have enough people? And I think Alabama will start seeing that become a big issue, as far as healthcare. If there was ever a cutback on elective surgeries, I think it's more, or elective procedures, I think it's more about personnel than fear of COVID.
That's a good point, and we'll use this as our moment to say thank you to all our healthcare workers, our nurses, our doctors, our any personnel, staff. We couldn't do it without you, so thank you so much. Quick question. I do not recall the name, but I should have asked you earlier, Leada. What is our death rate at right now, or our death count number?
Oh, our death count. Let's see. I should have jotted that down, shouldn't I? We are close to. Well, I say close. We're not at 2,000 deaths yet. We're about, y'all should have really, hold on.
You're good. While you do that, I'm going to, go ahead.
No, we're at 1733. We're at 1733. And we've been averaging, there was one day a couple of weeks ago we had 50, and that totally was ridiculously high. We have been, and that was the day that followed 0. So again, reporting is an issue there. 20 to 30 a day, which is way too high. It's way too high. Death lags hospitalization. Most people aren't admitted to the hospital, put on a ventilator, and die the next day. They're already in the hospital. Right. So we're still seeing that death rate, to be in that double digit every day.
It would have to, that death rate will follow, it seems like, a little bit lag behind the other progress that is made. Question that I think is interesting from Tina. So Tina says that returning college students in the state are going to be required to be tested to return to campus. That is true. We've done a lot of coverage on that. But she says most of these kids are seemingly well. So the percentage of positives of these tested will, be added in with the Alabama Department of Health numbers. So her point is, are we expecting that these numbers will either go down or up in the coming weeks as these college campuses reopen, as students start doing those required tests before they come back?
I think it will be interesting to see how that data is reported. And we don't know that answer yet, because obviously if you test 40,000 people, you're going to have positives, and they're going to add to the numbers. COVID is a required reportable disease. They can't not report it, or supposedly they can't not report it. But I personally, and I think we will get this data, would love to see, we tested 40,000 people at UA. If we look at our numbers, 13% were positive. I'm not sure. I don't think we're going to wake up one day. Now, I could be wrong, that we could wake up one day and say, oh, we're up 40,000 cases. I think you're going to see some explanation behind that of how many we are. Now, how many are showing symptoms, how many are not showing symptoms, that I don't know how they would even start. Are you have a stuffed up nose because you're allergic to trees, or do you have COVID? I mean, I'm not even sure how they would report that. But
yeah. A couple of rapid fire questions I have for you. And one kind of goes along with that. Tim asks, how many Alabama deaths are from COVID, and how many of those deaths are with COVID?
I would love to answer your question. I get that one a lot. I cannot answer that question. All we get is a flat number. It would be awesome to have more detail. I know that the health department over time has clarified and really tried to weed out. I went in for something, I died of a heart attack, and then I had COVID. Again, the second I say that, you're all going to send me that article about the guy who had the motorcycle wreck who died from coronavirus. I understand that. I cannot answer you that question. All I can say is the health department says we have had 1,700 coronavirus deaths.
I know, again, we wish we had more info that we could share there. Yeah. Quick question from Aaron. He says, do we have any idea what the delay is between a person getting a COVID test and getting the results, and then those results being added to the data? Okay,
great question. We have had delays as long as 14 days getting your results back. We have had we've had answers as quick as 24 hours. It just depends on where you go get that test and which lab processes it. People use rapid tests that you get an answer back in an hour, but the mistake rate is high. The error rate on those tests is high. So they're sort of like a quick defense. And you may have read the case about the Ohio governor who used one of those, tested positive, and then went back and had longer tests and tested negative twice. we do not know. There is not, as far as I know, they don't tell the lab you must update within 24 hours because, again, this is new. We've not really dealt with this sort of mass data influx, and they've had issues with mass data influxes. So we do see a lag. There is a lag getting your test results back, which has become a major issue. It's part of the reason why the quarantine rules were changed, because by the time people were getting their results back, they were better and no longer supposedly contagious. And then secondly, we do not know, but again, I think it's interesting. I can always look for an increase on Monday and Tuesday. So if you look at that there's not as many reporting over the weekend, if people are tested over the weekend, I'm going by 2 or 3 days for labs to put information in.
I hope that answers. I believe it was Alyssa had questions about that 24-hour change. And just to answer you, Alyssa, over our current, overnight cases were 1,655. Again, those are numbers that are reflecting overnight cases, but also could reflect some labs that maybe don't report over the weekend, and some kind of get balled up into one. As Leada said, sometimes the Monday and Tuesday numbers are a little bit higher. I hope we got all of your main questions here. If you have any other good questions, please let Leada or myself know. And as always, you can check out Leada's work and her articles that have that county by county breakdown. We will put that here in the comment thread for everybody.
Write it right now. So.
Yes, we'll give her a few minutes to get that finished before we put it here. But we appreciate all of you so much for watching. Everybody that is commenting saying or you are related to somebody with COVID, we are thinking of you and hoping that your loved one recovers and recovers quickly and easily. So thank y'all so much for watching. Thank you, Leada, for breaking it down for us, keeping it real over here with those numbers. And we appreciate you. We appreciate everybody watching. We'll see you tomorrow.
Thank you.